Ready? Hello friends, today we going to demonstrate a case of crooked nose rhinoplasty. Before to start the case, I just discuss in the brief then how we read the photography of the patient. My dear friends, the photography is really one of the very important tool for outlook analysis of the patient and pre-operative analysis also. So your photography that should be always by the DSLR camera, and in the pre and the post and the image in the pre and post photography that should be same. There is a lot of photography image we use, but I usually use the 6 standard image. Like we have the 6 standard image, like one in the frontal, and 2 is the profile view, and 2 is the this oblique view, and one is this basically basal view, and one is this cephalic view. So I need these 6 standard view, but the most important thing, what you analyze, because there are so many times I just think that just we not properly examine the patient. So the photograph, how you examine, like suppose first this is the patient of the frontal view. In the frontal view, first you assess, because all your photograph that should be in the Frankfurt horizontal plane except only the one. This basal view that is not in the Frankfurt horizontal plane, but rest all are the Frankfurt horizontal plane. So the head position of the patient that should be, because this is the external auditory canal, and if we line draw from this external auditory canal to the infraorbital limb, that should be the horizontal for the Frankfurt horizontal plane. So in the frontal view, what we assess, first we assess this or nose that is symmetrical or not from the rest of the face. Okay, so first we assess that my patient nose is symmetrical or not from the rest of the face, and then some 4 or 5 6 important thing we always assess. Number 1, like in the frontal view, first you check the symmetry of the nose. So look, in this patient the nose is not symmetrical, and then you assess the dorsal aesthetic line. So the dorsal aesthetic line in this patient, look that they are the ill defined, not well defined. And the third, we examine the deviation. If my nose is in the center or either deviated on the right side or the left side. So look that in this image the nose is deviated on the left side. Okay. So after the symmetry, after the dorsal aesthetic line, because what is the dorsal aesthetic line? Dorsal aesthetic line, the lines, imaginary lines from the medial most part of the eyebrow to the tip defining points. Okay. So in this patient they are ill defined. Then the deviation, and then after the deviation, the fourth point, we examine the width of the nose. Look that the width, the nose is the over wide. The nose is the over wide. How we assess the width of the nose? Because ideally the width of the nose, width of the base, that is the 2/3 of this ala base width. Okay, and then if you come down, then we assess regarding the tip. What you assess in the tip? First, the symmetry. Look that the tip is not symmetrical. This side we have the depression, and on this sides we have the bump on the nose, and then we assess the projection of the tip. Okay, that the tip is under projected, and in the frontal view we assess the relation between this columella and the ala. Ideally, for a good aesthetic pleasing appearance, this columella that should be 2 to 4 millimeter hang below this ala margins, that we can, the girling flying appearance, or this is columella show. So these 5 or 6 important things we assess in the frontal view, and then we come to on this this profile view. So in the profile view we assess first the detail of the radix, and the detail of the dorsum, and the detail of the tip. So when we assess the detail of the radix, then first we assess my radix is the deep or shallow. When sometimes the radix is deep, then you know the nose appear the short nose appearance. Look that in this patient the radix is the shallow, so the nose appear the longer appearance because the radix that add on in the length of the nose, so the nose appear the longer appearance. And we assess the nasofrontal angle. Ideally the nasofrontal angle is around the 120 to 130 degree. Then if you come down, then we assess regarding the dorsum. Ideally the dorsum, when we define the line from the nasion to the tip defining point, then ideally the line that the dorsum fall around the 1 millimeter behind this line. Okay, if more than this, then you have the bump on the nose. Look that we have the bump on this patient, and if you more behind, then that means your patient need the augmentations. Then you come down on the tip, then we assess regarding the projections of the tip and the rotation of the tip. So the projection of the tip, that is the distance from this nasofacial groove to the tip defining point. Either your nose is under projected or over projected. And regarding rotation, how we assess? We assess in the nasolabial angle. Look that in this patient that is little bit obtuse. So ideally for a male patient, the nasolabial angle, that is around 90 to 95 degree, but in a female patient that is around the 100 to 115, so little bit obtuse. And another important thing we assess the relation with this ala margin to this column show. Ideally the column show, that is the 2 to 4 millimeter. If more than this, then you have the excessive column show, and less than that you have a retracted columella. So sometimes the relationship is very important, because you know sometimes it's very difficult to say that your patient have a retracted ala or your patient have a hanging columella. So in that situation you draw a line from the medial most margin to the lateral most margin of the ala margins, and if you draw a line from this to this, if this is more than 2 mm, that it means this is the retracted ala. Okay, so these some important thing we assess in the profile view. Now if you come on the basal view, in the basal view we assess regarding the orientation of the nostril, symmetry of the nostril. Look that the both nostril in this patient is not symmetrical, so you can assess the anterior part of the caudal septum. So the patient have a caudal part of the septum is deviated towards the left side, this part, so the foot plate is flaring on this patient. And orientation of this nostril also we assess. And another important thing that we assess in the basal view, that is the relation between the tip and this columella ratio. Ideally there is a 1:1, that the tip lobule is 1 and 2 part is this columella show. And another important thing that we assess this ala base width is there is a over wide ala base width, and we also assess the ala flaring also. So what is the ala flaring? If there is a excessive concavity of this convexity of this ala margin, that is the ala flaring. If this contour, this convexity is beyond this ala facial junction, that means your ala is flaring. And if this width is over wide, this is sometimes, then you have a over wide ala base, that this is the sill part of the nose. So all these detail we assess in the basal view. Now this is the cephalic view. So look that in the cephalic view, what we assess, sometimes if your patient have a minor deviation, then we can assess better in this cephalic view. So look that if you in this both view, in this view you can assess the better the deviation in the nose and rest of all details. And another, the last view, that is the oblique view. In oblique view we assess rest of all these finding we confirm, and we also assess the ala detail and side detail of the patient, particularly on the right side and the left side, the contour of the ala, any depression on this ala. So these are the important things that always you should assess. So you just remember all these things, what you want to assess in the frontal view, what you want to assess in the basal view, what you want to assess in the profile view. These are the important thing, and all these things you document. so it help in your surgical planning of the patient. So guys, you always your photography analysis that should be systematic manner, and all the you keep like this in your OT when you do the cases. So meanwhile when you do the case, then you can assess. So this case tomorrow we just post on my YouTube page. Thank you.